The findings of our study is we set out to compare the rates of joint replacement between TNF inhibitor users and users of non-biologic DMARDs. The main findings were that amongst everyone, when we looked at the whole population, there was no difference in joint replacement rates between those two groups. And that was the case for knee, hip and other joint replacement. However, when we looked at age specifically, we found that amongst older patients, those above 60 years old, they had a 40% reduction in hip replacement if they were on a TNF inhibitor. Well, it's hard to tell. This is an observational study, so there are various limitations. It's suggestive that these patients may benefit from being initiated a TNF inhibitor. We know that already from prior studies that show that TNF inhibitors improve a whole host of other outcomes. This study, the novel feature of this study is it suggests that maybe those translate for the older patients to an improvement in not needing a joint replacement, or at least not needing one quite so early. This study does need to be replicated in other cohorts, however. So that's a very good question, and is one that we need to do further studies to really understand what exactly is going on. The various potential explanations could be that this is a cohort with quite established disease. We had a high disease activity overall, and it may be that in some ways the joint destruction had already occurred in this particular sample for the biologics to have an effect. It could be that this study does indicate that the decrease seen across the board in Western countries of a decrease in joint replacement rates in RA, that decrease may actually be driven by improvement in use of conventional synthetic DMARDs rather than biologics. So one which we're working on at the moment is to replicate it in another sample, another country, look at what the impact of TNF inhibitors would be in a different healthcare system. Also a separate study, and one we're hoping to have ready for this time next year, is a robust, thorough health economic model. So weighing up all the pros and cons, the benefits of TNF inhibitors in terms of maybe reducing joint replacements in the elderly, over and above the increased cost of the therapy itself. So there are numerous avenues that we're exploring.